come on in, take a seat. Can you confirm your first and last name for me? Perfect. And it looks like today we are doing an IUD insertion for you. Okay, just want to confirm. Let's see here. It looks like you already had the IUD consultation and that you decided you wanted the Mirena IUD, which is the hormonal progesterone only IUD. Would that be accurate? All right, just making sure. Have you had any changes to your insurance or pharmacy on file? Okay. And any changes at all to the medicines that you are currently taking? Not taking anything? Okay. All right. And any allergies at all to like iodine, lidocaine, anything like that? None? Okay. Just gotta make sure. So I will basically be taking your vital signs today. I will be getting you that sedative pill. It's just like a tablet, you just chew on it. And then Leanna, the PA, will be in about 5-10 minutes once that sedative starts taking place. Because it looks like you opt for that anti-anxiety, right? Okay, just making sure. All right, and then of course we'll just need a pee sample from you to confirm you're not pregnant, and I just need you to sign a few forms about the Mirena IUD so that you of course have full consent and you understand the risks and the side effects associated with having this IUD. Are you currently on any other forms of birth control? No? Okay. All right, let's get started here. So I'll just do your general vital signs first, and then we'll get to the paperwork that you have to sign. Just need to get your blood pressure. All right, if you want to slip that through. Blood pressure's a little higher, but I take it that you're pretty nervous. Yeah. Honestly, most people are with their IUD insertions. You hear people have so many different experiences. Some people say they felt nothing. Other people say the literal opposite. But you are in good hands. We'll take good care of you, okay? For sure. And I take it you were sent like patient education that sort of went step by step on the whole process of the insert. Good. Awesome. All right. Just make note of the blood pressure here. Do the temperature check. This is going to go underneath your tongue. There you go. All right, very good. Temperature is done. Awesome. Okay, so to kind of confirm, You are getting, it looks like from the package, the Mirena IUD. An IUD stands for an intrauterine device that sits in your uterus and acts as a form of birth control. Now for the Mirena IUD, you know, this is a progesterone only, so your bleeding patterns may vary. You may not get any bleeding at all with the IUD. You may get irregular bleeding or spotting, or you may get what appears to be regular cycles, but perhaps a lot lighter. So most people who have the Mirena also use it to treat heavy periods as well. Now the Mirena IUD right now is approved for up to 8 years for birth control, but still only 5 years if you're using it for bleeding regulation. They work extremely efficiently and effectively, and they work very quickly. IUDs are even a form of emergency contraceptive, which a lot of people don't even know. So, you know, what we're going to have you do is once we insert the IUD, we'll want to see you 4 to 6 weeks after this insertion just to make sure that the IUD didn't get misplaced or is not falling out. Now, of course, if it ever falls out at home for whatever reason, I need you to save it for me and bring it in so we can make sure it's intact, which leads me to the risks of IUD insertion, the most common ones being uterine perforation, meaning the IUD would go through the uterus and have to get surgically removed, or self-expulsion, meaning that your body will reject the IUD and push it out. They reviewed all of that with you, okay? Now, some common side effects unrelated to bleeding patterns could be mood changes, headaches, increase in acne, or weight changes. Do you understand all of that? Okay. If you wouldn't mind just signing right over here that you consent to the IUD insert, and you understand the risks right over here. Thank you. All right, excellent. So, what we are going to do next is I am going to give you this tablet. This is the anti-anxiety. I just want you to chew on it, okay? So here, this is for you. Just kind of chew on it. And then what's going to happen is you just have to leave me that urine sample. So we'll put your name on the bottom here. Okay, so I will leave this for you. That tablet should become effective in about 10-15 minutes. In the meantime, if you could just leave that urine sample so we can confirm that you are not pregnant, you can just leave it on the counter by the bathroom for me to take a look at, okay? For sure. And then while you're doing all of that, I'm going to get this room set up for the IUD insertion. Now, when was the first day of your last menstrual period? Okay, so just finished a day or so ago. Okay. All right. And so there will be a drape waiting for you. Everything top-wise can stay on. You'll just get undressed, waist down. We sort of start with the same steps as we would for like a pelvic exam, and then we'll walk you through the whole thing. Oh yes, absolutely. So I'm going to go take these consent forms. You can get started on that urine sample, and then Leanna, the PA, will be in. Let me check you in so she knows you are ready. And then we will get that IUD inserted in no time. Oh yes, not a problem at all. She'll be in about 10-ish minutes, okay? Awesome. Hello, hello. We're doing that IUD insertion today. And how are you feeling? You feeling okay? A little bit tired. Awesome. And the girls were telling me you did bring someone back with you in the waiting room to drive you home, right? Awesome. So it looks like you signed both consent forms for the IUD insertion. Pregnancy test was negative as suspected, so we can move forward. But I just wanted to ask and confirm whether or not you had any questions or concerns before we got started today. You ready? Awesome. It'll probably go by a lot faster for you, okay? So I will walk you through the whole thing. You'll know what's happening step by step. Now, of course, if you're someone who doesn't want to know what's happening every step of the way, Just tell me to stop talking. For sure. All right. So let's get everything going here for you. I am just going to grab some gloves. All right, very good. Let me grab the light here. Alrighty, and then if you could scoot just a little bit more down for me. Perfect. Alright, just grabbing a speculum here. Oh, by the way, I forgot to offer you. Would you like Sally the speculum or Spermy the stress ball? Both. Okay, there you go. Yeah, you can just like squeeze on him. All right, let's get some lubricant on this for you. Alrighty, you're going to feel my gloves here. You're going to feel that internal pressure. You're doing great. I'm just locking the speculum in place. Your cervix is in perfect position. The next thing that I'm applying to your cervix is an iodine solution, and this is just going to make it more sterile and just a cleaner environment to insert that IUD, okay? So you're going to feel probably cold in a cotton swab. Okay, get some more. By the way, you may get some irregular bleeding after this, okay? We love how informed you are. All right, this next part here is what we call a tenaculum, and this is the part that we talked about that's used to hold your cervix in place so that we reduce the risk of perforation. What I'm going to ask you to do is I'm going to ask you to cough, and that's when I'm going to hook it onto your cervix, okay? Okay. Cough a few times for me. There you go. Did you feel that? Awesome. Yeah, no, the coughing strategies are really good, like distraction for the body. So I find that most patients oftentimes don't even feel when I do that part. So it looks like our next step here is actually going to be to measure with an instrument to see how far up we're going to put that IUD in, because everyone has different size uteruses. So this is where you are going to feel that intense cramping that we talked about, okay? Yes, and if anything is too unbearable or anything like that, you gotta let me know, okay? All right, so this is gonna go in, putting it through the cervix now. Keep taking those deep breaths in and out. You are doing great. And it's coming out. Alrighty, so you are measuring at about 7. Pretty good. So now what we're gonna do is we're gonna open that IUD box and we're gonna get that IUD in. Yes. All right. Mirena IUD. Perfect. We are going to change this toggle here to 7. Very good. All right. This is just going to last less than 10 seconds. It's going to feel similar to what you just experienced, but probably a bit more intense because this is a little bit thicker, okay? All right. Take those deep breaths for me. Deep breaths. The IUD has been released. Just taking it out. And it's in. You handled it like a champ. Probably went by a lot faster than you were thinking. No, you seriously did awesome. The last part here is I'm actually just going to cut your strings for you here. So give me 1 second. You're not going to feel this. It's just a string. Excellent. Okay. Very good. Going to put those back here. Let me get everything cleaned up here for you. Are you feeling lightheaded at all? Like you're going to pass out? You're okay? All right, you just let me know if anything like that changes, okay? Okay, let me take this instrument off your cervix. There you go. And then I'm gonna remove the speculum. Okay. Now, I am just gonna cover you up here, and then if you want, just stay laying down. Keep kind of taking deep breaths in through your nose, out through your mouth. I'm going to leave a pad here right on the counter next to it. Or you know what, I'll just hand this to you. Like I said, you may get that irregular bleeding, but you call if there's any question, concern, or something just seems off, okay? Okay, good. So with that being said, I do have education on the IUD that we put for you today. Again, reviews everything we talked about at the consult as well as during this visit. So this is for you. The other thing that I want to grab you though is I do want to give you some more pain medication for you to take home. Okay? Yes, and you only need to use it if you feel like you really need to. Okay, it's not something that's required. All right, give me 1 second. Let me grab those for you here. Okay, you'll take 1 tablet every 12 hours as needed for the next week or so, okay? Yeah, so this is for you. Do you have any questions at all on the IUD insertion that you had today? Okay, all right. So I am going to tell the girls at checkout that I want to see you in 4 to 6 weeks for what we call an IUD screen check. Yes, absolutely. All right. And then they will, of course, give you just some general aftercare instructions. For sure, yes, I'm going to give you some privacy. Please take your time. If you need anything, Leah and May will be right outside the store. But otherwise, you are all set today. Congratulations on getting your IUD. I hope you love it as much as a lot of other patients have. And of course, if you don't like it, if it's just not what you expected it to be, you know, it's recommended that you give it about 6 months or so before you really judge it. But if you need it out sooner, I am more than happy to remove it for you. No, that is not a problem at all. All right, well, I'll give you some privacy. I'll see you later, okay? All right, see ya.